Okay, we're live. So let's go ahead and get started. So first of all, I want to say thank you to everyone who's watching for joining us today for a very special Let's Talk on Getting Back on Your Feet with Economic Services. Now, what are economic services? It can be everything from rental and utility assistance, food assistance, Medicare, education assistance, and there are many more types. Today, we're joined by a great team of experts from our Buncombe County Health and Human Services. The ones where if you needed assistance with anything, there's probably a chance that you will speak with one of them. So let's just do some really quick introductions to everyone on the call.
Hi, I'm Becca Ledbetter. I work with Family and Children's Medicaid with Buncombe County Health and Human Services.
Hi there, my name is Nick Fierstos, and I'm here today because I'm a worker with the new housing program with Buncombe County Health and Human Services.
Hi, everyone. My name is Tiffany Ayers. I'm a food nutrition supervisor.
Hi, I'm Tracy Franklin. I'm a supervisor of economic services. I work with contracts and the COVID housing program.
Thank you all so much for joining us here today and helping to unwrap the economic assistance options within Buncombe County. Before we hop right in, I just wanted to give some quick house rules. So if you're watching this on Facebook or Zoom, I will be monitoring the chats for questions. So feel free to ask anything you like. We'll get to as many of them as we can. Also, this is available in English and Spanish. The English is on buncombecounty.org's Facebook page at BuncombeGov, and the Spanish is on Health and Human Services page at BCHHS. So we have a lot of topics, and let's hop right in. First, we're going to speak with Nicholas Fierstos on housing assistance, one of the more common types of assistance that we're talking about with economic services. So tell me about some of the programs associated with housing assistance for Buncombe County, Nicholas.
Sure. So the housing program that we're talking about today is it's a new program, and the idea behind it and the reason for it is that, as everyone knows, in 2020, a lot of people got behind on their rent, on their utilities, because so many people lost income and so many people lost their jobs because of the COVID pandemic. And I think that Congress recognized that a lot of people were having a hard time. And so, as most people know, Congress passed a series of bills, and a lot of us got, I think most of us got stimulus checks. And so we all know about those checks, but part of one of those bills was the Emergency Rental Assistance Program. And because of that bill, I think it was the second stimulus bill that was passed, the county is just starting on this new program where we can assist with folks who lost income because of the COVID pandemic and need some assistance with their rent and their utilities.
So it covers rent and utilities. Can you go more into what that means? Like what type of rent, what type of utilities?
Sure. So we're often helping people with their Duke or just electricity bills, because a lot of people got behind on their electricity bills. We're able to assist with water bills as well. I need to emphasize that this is still a new program. So these are the types of utilities we're helping with right now. It's possible that in the future we might be able to help with other things, but right now I know that we're just helping with those things at the moment. As far as rent goes, we're able to help with folks who got behind on their rent, because of this COVID pandemic. So folks who got behind on their rent after the pandemic began, which was about like last March, and coming up through the present, folks who got behind, we can help, kind of catch them back up.
So is this housing assistance just for COVID relief, or is it just like your general housing assistance program that got a boost as a result of COVID?
No, this program is specifically for people who are negatively impacted financially by the COVID pandemic.
Great. And you said it covers your rent and it covers any utilities you have. How does this work? Do you just send the bill and you cover that, or?
Sort of, that's right. So you would want to make an application, and I believe that within the chat here we'll have a link so that people can access the the inquiry form. And when you have that inquiry form, you can mail it in, you can email it in, you can fax it in, or if you just want to, you can just call and just ask to be, added to the list so that you can be considered for the assistance program. Once you are, you'll be assigned off to a caseworker. And all of the caseworkers who are working on this program are professionals with a lot of experience working with the county in different types of programs. So they will make sure to get with each person who's applied to ask for the sorts of things they need. So yes, but to answer your question more specifically, the caseworkers would work with the applicants to make sure to get things like, the specific bill that they need help with, or to, work with them to, obtain a verification from a landlord to show that, this is how many months back they are. But, so there is going to be some requirements that they provide some verification, but that should not, be something that anyone needs to worry about before they go ahead and send in that, application for assistance.
And when I hear things like assistance from local government, I think like, oh, well, maybe they'll pay like a little part of it, or maybe it'll just be a stipend towards your rent or mortgage. But how much would this actually cover?
I don't believe that there's necessarily a high limit on this. It seems that most folks around here are paying, $800 to $1,400 rent, something like that. I'm not sure that we have necessarily a limit right this minute. I don't also think that, like I told you, this is a new program, so I haven't seen anything yet where
Haven't tested the limits yet.
right, where somebody's coming and say my rent is $25,000 a month. I haven't seen that. So, these are things that we're going to have to hash out as we move along because it's so new. These other experts who are here today have been in their programs for years. This county has, administered food stamps and Medicaid for so long, and that we know every little dirty detail of these programs because we've been doing it for so long. This program, we're still, kind of working out some of these little details. So we're only a couple months into it, and we'll probably figure these things out more as we move forward.
And I know there's a lot of factors that will help determine this next question I'm going to ask, but how long does this service last? How long can you receive assistance? Is it just 1 month, or is it, sorry, I have a siren. Someone else is getting assistance right now.
Right, yeah, that's, I don't know if that's the county. Right now we're able to help catch folks back up for their arrears, what they're behind on. We are able, or we can also help with a little bit of future rent, like up to 3 months. Beyond that, someone might have to come back, if we approve for like 3 months, they might come back later and see if we can approve more than that. But that's what we're doing right now. And, just as I was saying before, we're still kind of hashing those details out. But for right now, 3 months into the future, or else, folks' arrears that they're owing from months past.
Awesome. We had a question online. We're not going to get to it yet, Daniel, but I did see that you left it on medical help, and one of our topics in today's show is going to be Medicaid, so we're going to get to that soon. But going back to housing assistance, I wanted to talk about, how do you apply for this assistance?
Sure.
Where do you go? It seems kind of overwhelming to someone just hearing about like, oh, how do I get this money?
Well, one thing you can do is call just the county main number, 250-5500, and ask to be, listed onto the list of people who are being considered. And otherwise, I think that we've supplied a link to the inquiry form. So if you don't want to call, you can also click on that, get that form, fax it in, email it in, any way you want. But it's very easy to just call the number of the county, get through to the workers at the desk and tell them that you would like to be considered for the COVID housing program, and you'll go on the list and someone will contact you.
And I did put a link in the article to anyone watching this on Facebook for the English version. Sorry, I only have like 5 computers. I don't have a 6th one, but there's a link there to an article that has the forms that you can actually download and print off yourself, or just call the number and you will be directed to someone who can talk with you one-on-one, which many people find helpful. So one question I asked before we hop into another topic of assistance is the idea of equity and how we're making sure that anyone who calls can easily access and apply for these types of services. Nicholas, would you mind touching on that a bit?
Sure, I can talk a little bit about that. I was used to be a well, I guess I'm still a bilingual worker. I work with Spanish and English speakers. And it's just, I just need to let everyone know that, English proficiency is not a requirement at all for any sort of assistance that you look for from the county. We have on staff, there are full-time interpreters. We have full-time bilingual staff. And these are for like the full-time people are, mostly Spanish and I think 1 or 2 Russian folks, but also, if any language, we have telephonic interpreter services. We have contract interpreters. So, regardless of the language you speak, you're going to be able to access services with the county.
And this is a new program. Have people taken advantage of it so far?
Yes, we've had a lot of people, and we actually have we're working on moving through the folks who have applied right now. So every day we're calling and helping these folks out, and we have moved through a bunch of approvals. And I know that even me myself, I've managed to approve a good stack of them. I'm not sure exactly how many I've approved, or how many we've approved altogether. But yes, we have been able to pay out rent and catch people back up on their rent and their utilities.
Are there any common questions that you're getting from people who sign up that maybe that wasn't clear, or is something we haven't covered here about it? We don't want to go too specific because we have a lot to cover today, but just like if there was any trends you noticed and questions that people had.
Mostly that folks, they one thing that we just do have to tell everyone is that the common thing that is going to have to be shown here is that there was a loss of income or, a job loss of some variety, and that it was tied to the COVID pandemic. So that's probably something good for people to know.
Okay.
That's kind of the purpose of this program.
Okay.
Mhm.
So thank you, Nicholas. That's a great overview of getting housing assistance. And there's housing assistance, and then there's emergency assistance, which confused me when I first started researching this with housing assistance. And we're going to talk with Tracy Franklin about that. So Tracy, we have emergency assistance. How is that different from housing assistance? Because it seems to cover the same stuff.
So emergency assistance is our regular rental assistance program that we offer. It is a program that allows us to help families with children with up to $450 towards rental expenses, water bills, electric bills, other utilities, to help that family get through an emergency. For emergency assistance, the primary requirement is that the household contains a child in the home under 18, and that the family is within 200% of poverty for an income limit. The services are direct vendor payment services, so we do make those payments directly to the landlord or the utility companies. And this program is offered through we have a contract with Evelyn Charities. So it's administered through Buncombe County Health and Human Services, but applications are taken at Evelyn Charities. And I think we have a link for their site. Applications, they are doing applications by phone and through mail right now.
So what signifies an emergency? Because obviously COVID is not considered the emergency you're talking about.
Yeah, so this is families that are facing eviction or at risk of losing electricity or their water. So typically the program does require some kind of final notice or an eviction notice. There has been some changes with it this past year because of COVID, that we don't quite have to have them at eviction. If we know they're behind, then we've been a little bit more flexible and we've been able to help.
So you talk about home assistance. This is also for utilities. What kind of utilities would this cover?
So it's primary household utilities. So it'd be electricity, water. It can do some heating assistance, but we have other programs that offer heating assistance. I can speak to those. The primary program that we have for heating assistance, or it's actually heating or cooling related assistance, is called Crisis Intervention Program. And that is a program that can help with up to $600 in a vendor payment for heating or cooling related needs.
So can I interrupt you really quick? What is a vendor payment?
So that is whenever you get $600 worth of assistance, you don't receive those funds yourself. The agency will pay that to the vendor or the company that is providing your heat or your oil, that sort of thing.
So we just you get the bill and then you just take the bill and run with it.
Yes.
Okay. And this is also good emergency assistance. Like if it's in the winter and it's cold out, it's not a matter of things being shut down. It's a matter of we need to be able to survive. This is an emergency.
Yeah. So the emergency assistance program is available year round. And that one is the one that will do rent assistance. The other program is called crisis intervention. And the purpose of that is to resolve a heating or cooling related need. It's a different pot of money. It is available year round, but most of our applications are through the winter time when there's a crisis with the weather.
Okay. And is applying for this different than applying for the COVID housing relief?
Yes.
How's that different?
Yeah, so these programs are administered through that contract with Evelyn Charities. So the applications are taken at Evelyn Charities. And so if anyone's interested, you would just reach out to Evelyn and ask them for an application. Right now, they're doing those by phone and mail. But yeah, so we administer it, but they're the ones that work with the customers and distribute the payments.
But you'll still, if somebody calls you for, I want people to realize that if someone calls HHS and says,
Yes.
I need housing assistance, you will work with them on every type of assistance you have, even more so than the topics we're talking about today.
We will.
Great. So we're going to switch tunes real quick and move on to food assistance. And to tell us about food assistance is Tiffany. So we all know food assistance by its maybe traditional name, food stamps, but it's kind of evolved a lot since then. Tiffany, tell us about what food assistance looks like today.
So food assistance is a federal program, and the mission of the program is to provide low-income families or individuals access to food that they need to have a nutritionally adequate diet. I know some of the folks that we've talked to thought that food assistance was only for families, but you can actually receive food assistance for yourself if you're an individual. The food assistance program does provide a monthly allotment to eligible households. Those benefits, if you're approved, are dumped onto an EBT card that you can use. So to apply for food assistance, there's several different ways. I know it can be overwhelming. You don't really know where to start. So we've it's a pretty streamlined process. There are 4 ways to apply. You can apply online with ePass, and we're going to put that link in the chat. So the ePass is our online version. It's available in Spanish and in English. You can also apply in person at our HHS office, which is on 40 Cox Avenue. You can complete a paper application and you can mail that in, or you can bring it by and drop it off at our office on 40 Cox Avenue. We do have a drop box out front. So if you needed to drop that off after hours or on your lunch break, let's say you didn't have time to come in to the agency, you could put that in the drop box. And then currently, because of COVID, we have a 4th option to apply, which has made it very convenient. You can actually call our office and you will be linked to a caseworker who can take the application over the phone. So you can call on your way to work, you can call on your lunch break. So it's made it very convenient for clients to apply for services right now. One piece I did want to mention is we've tried to make it a very streamlined process. So once you apply, the caseworker, your application is assigned immediately to a worker and they start determining your eligibility. We really strive to use our electronic verifications to be able to obtain all the verifications that we need so that clients don't have to provide that information unless it's the last resort. So that's also a great perk, and it allows us to process applications quicker to get the clients the benefit. And also just help them out because we know it's a stressful time and we don't want folks having to run all over the place trying to obtain verification. So we try to do that for everyone and only request that information if we can't obtain it ourselves.
That's a good point, because I think with any type of service you're asking for assistance for, you think, what type of documents do I need to have prepared before I call? And you're not asking for documents to be preparing for this stuff. You're asking people to call, and then we'll help you once you call.
Right. Yes.
So for more about food assistance, what exactly does the food assistance cover? Like, what can you buy with it? Where can you go with it?
Sure. So the FNS benefits can be used to purchase most foods at EBT authorized retailers. And those are most of the major grocery stores, your Food Line, your Ingles, your Publix, your Walmart, convenience stores. You can also use it at various farmers markets. And then another awesome thing that come about because of COVID to promote social distancing and transportation barriers is the option to purchase food online at eligible online retailers, which is Aldi and Amazon, Walmart, Food Line, Publix, all of those. That is something that will continue post-COVID. So clients can go online, order their groceries. You can have those delivered. You can do curbside pickup. The only thing I would point out about that is you can use the benefits to purchase the food, your eligible food items, but the delivery fees and the service fees are not included. You can't use your EBT card for that. So that's something you would have to pay out of pocket separate. So that's a really awesome perk, and that's actually going to continue. We've had a lot of really good feedback about that because it gives our food assistance clients the option to participate in those online purchases or the delivery options. As far as what you can purchase, so eligible food items include, fruits and vegetables, meat, poultry, fish, bread, cereals, dairy products, snack food, non-alcoholic beverages. You can also, and I think this is pretty cool, you can also purchase seeds and plants so that you can produce your own food for your households to eat. So I think that's pretty awesome.
That is very awesome.
Yeah, that's very cool. Items that you cannot use your benefits for are things such as paper products, tobacco, pet food, soap products, medicines, vitamins, or alcoholic beverages.
Great. So basically things that you can eat, not things you can't eat. Soap. So
Can't eat soap.
and depends how many curse words you've said.
Right.
Obviously the eligibility and how much you get has a lot of determining factors. Like how much food assistance do you get when you get food assistance? What are some of the factors that determine that?
So the amount that you're eligible for is definitely based on your household size. When we're looking at eligibility, there's several eligibility factors. One of the first would be, of course, income. And so your income limit is based on your household size. And then if you're approved, of course, your allotment is based on your household size. So if you're a household of one and you're approved, you're going to get a smaller allotment than, let's say, a household of four.
Are there any restrictions to getting food assistance? Are there citizenship requirements or anything like that?
So I would definitely suggest if you have a need to apply, there are some basic eligibility requirements, but then, there's different moving pieces to that. You may be eligible if you're an individual, you may be eligible if you have children, disabled, some students can be eligible. Your household could potentially be eligible if you're an undocumented alien and then you have children or household members who are US citizens or LPRs or refugees. The list kind of goes on. So some of the basic eligibility factors, of course, would be your income. It's based on your income for your household. Residency, you have to be a North Carolina resident. We look at citizenship and immigration status. Household size, enumeration, student status, those type of things. But again, if you have a need, I would definitely apply and then let the caseworkers
work with
dig
you.
into your information, and determine your eligibility from there.
Yeah, you all want to help people. Like,
Yes, absolutely.
awesome. Do you ever get any common questions from clients concerning?
Sure. So one of the questions, two things kind of stick out. Of course, what's our turnaround time? I've applied. What's my turnaround time? So if you qualify, you will receive your benefits no later than 30 days from the date that we receive your application. If your household has little to no money and you need emergency help, you may be able to qualify to get food assistance within 7 days. So that's kind of the state time frame. But I will say that currently in Buncombe County, we have an average processing time of 10 to 11 days. So it's very quick. So shout out to all the workers who are making that happen. So it's very quick. Another question that we get a lot is after you're approved for food assistance, how long does it take to get your EBT card? When will I get my benefits? So once your application is approved, the EBT card goes out immediately. It typically takes 7 to 10 business days to get that at your home. And then once that card arrives, you'll just activate it and you'll put a PIN number on it, just like your debit card. And then it's ready to use. And your benefits for the month of application will already be loaded onto that card. Sometimes it's the first and second month of benefits, but that depends on when you apply. But you'll definitely have your first month of benefits on your card, and you're able to use it right then. Go to the store as soon as you activate it.
Awesome. Well, thank you, Tiffany, for telling us all about food assistance. And we're going to pivot from food assistance to the STEP program, which you don't know what that is unless you've been in it already, because it's not like the food assistance, housing assistance. What is STEP? And there's a reason we're talking about STEP after food. And Tracy's going to tell us about that. What is the STEP program?
So STEP is the Skills Training and Employment Program. It assists food and nutrition services recipients that are age 16 or older with free employment assistance, high school equivalency, and occupational training courses through AB Tech. We can pay the costs of books, materials, uniforms, test fees, and courses for occupational skills and continuing education.
So if you have an EBT card, if you are getting food assistance, you are automatically kind of pre-approved almost for the STEP program, depending on if you're back in school or you need school assistance or assistance.
That food nutrition services is the only eligibility requirement for this program. This program is a partnership between Health and Human Services and AB Tech. And so if you get involved with this program, you'll work with what we call an education navigator. And that's a specialist that works with AB Tech that can help you to enroll you in continuing education courses and offer employment assistance in helping you look for employment. And basically, they really provide a lot of supportive services to help people get through that course and to seek employment afterwards. And the great thing is that this program will pay for the cost of the classes.
That's awesome. It'll pay for the cost of classes in terms of continuing your education, but what other employment services does it offer?
So with this program, we do have an employment center. We call it the STEP Career Center, and it's located over at the Eddington Center off Livingston Street. And if someone goes into that center, they'll receive one-on-one support in looking for employment, help with a resume or a cover letter, and occasionally some direct employment contacts. Whenever we're not dealing with COVID, from time to time, we have some job fairs and one-on-one meet and greets with employers. And so the purpose of this program is to help those food and nutrition services recipients to upskill, gain some skills, move into their career, and hopefully link them with an employer.
So it covers those services, and it covers the class costs, I assume, and I assume books and maybe some materials.
Yes, And with this program, we do offer a like transportation stipend, like a travel reimbursement, where if you're participating in this program, for each month you're participating, we send you $75.
Just for help to get you to the classes
Yes.
when COVID's over. So what about, and what are some other indirect like benefits to this? What about like, does it offer childcare for people who are trying to continue their education and they still have kids at home?
We don't directly offer childcare, but we do a referral for our childcare subsidy program that's offered through the county. And so we will link the person with the resource. I think the greatest asset to this program are education navigators, as they're knowledgeable about a lot of community resources. And so they'll work with that participant, find out what any employment barriers are, and then try to find a resource to help if we can't help them directly.
Awesome. And one last question, like is signing up for this just as easy as like, will you be directed from the food nutrition, or is this something you have to ask for?
So the food nutrition worker will probably tell you about this program, but before COVID, we had like an orientation where people came into our agency and met with us. But now we have an online way that people can access an online orientation, and they can fill out their information and it'll send their information directly to us so we can call them and enroll them. Other than that, people can call our agency, the 250-5500 number, and ask for the STEP program, and they can be linked with us that way as well. We will do the intake over the phone, and a lot of the work right now is remote.
And how long does this assistance last? Like, can you get like how long can you get education assistance? Is it tied with food, or is it like, will it pay for your whole degrees?
No, so we're focused on continuing education. So we aren't paying tuition for a 2-year degree, but we do have resources. Our AV Tech specialists can help find scholarships for people or help with that enrollment process. Our focus are the shorter term needs. And I think that we can help with 3 classes. And there's not a time limit. I have seen people be on this program for a year. The purpose is that we can try to help people while they're working with food and nutrition services. So whenever they become ineligible for that, then we have to discharge them from this program.
And what are the type of classes that people typically take with this?
So most of our interest has been like medical related. So we've had a lot of nurse aid, the CNA, and like med tech, a lot of the phlebotomy. But we have had some people take other courses like CDL, truck driving. We did have a family with someone that took that and got a job earning over $20 an hour. We're excited about that. So it's any of the continuing education courses. If someone gets one of those AV Tech catalogs, there's a big green section of those continuing skill building courses. And so anything in that section.
Free food and phlebotomy. I just wanted to see if I could say that. Sounds like a great program.
Yeah.
So we're going to hop on to Medicaid as the next topic. But before I do that, I want to remind everyone watching on Facebook if you have any questions, I'm looking at the Facebook feed right now. Please feel free to submit them. We've got a couple come in so far, but we're going to get to a Q&A section at the end of the show. So definitely submit them. And the last topic, because Becca has been so patient, is we're talking about Medicaid. And Medicaid, from me, who doesn't work in economic services, I think of it as low-income health insurance. It is that, but it's also much more. So give us an introduction to Medicaid 101, Becca.
Okay. So everyone should just consider Medicaid literally to be health insurance. It will cover an individual's medical care. It includes doctor bills and prescriptions and lab tests, vision, dental, mental health services, physical therapy, and the list just kind of goes on. And in North Carolina, we even pay for chiropractic care, which I think is very cool. So it's just a full benefit health insurance.
Okay, and is it just for low income individuals, or is it available to like other people depending on their circumstances?
So typically, so in Buncombe County, the majority of our recipients are children. So we have a higher number of children, but the income limits, yes. So our income limits, though, are very high, are much higher probably than people would expect. So for a family of four, for a child 6 through 18, the high end of the income would be $4,600 a month. And so for children, we have very varied programs that they could be eligible for. When you apply for Medicaid in North Carolina, you apply for all types of North Carolina Medicaid. So there are a lot of programs under that umbrella. And they are typically in Buncombe County, they're divided between one division handles aged, blind, and disabled individuals. And the other division handles what we call family Medicaid, which is where I work. And it would handle, we would cover pregnant women, children under the age of 21, and then caretakers. But even if your income exceeds our limits, we also, North Carolina is one of the last states that has a deductible program where if you make too much money for regular Medicaid, we could compute your deductible, and then they potentially could be responsible for only that portion of a very large bill if they have a major medical incident.
Awesome. So we had a conversation before this, and I learned something interesting in that you can have private insurance and still get Medicaid.
You absolutely can. That's something that a lot of people probably are unaware of. We only have one program under North Carolina Medicaid, and that is the North Carolina Health Choice. Even for that program, though, the parent, that's a children's program. But the parents would be given the opportunity to drop that private health insurance if they choose to, if they would prefer to receive the North Carolina Health Choice. But for all the other programs, you could have Medicaid and the private health insurance, but the private health insurance will be primary, and then North Carolina Medicaid would be secondary. But even with that, if your private health insurance has a deductible or it has copays, then North Carolina Medicaid would pick those up for you.
Okay, great. So it's almost like, because deductibles can be very high for many people, like insanely high. So
Yes.
Medicaid can come in and kind of help offset the burden of that.
Absolutely. And we've had many situations where with children, the parents have the policy that they can afford does have that really high deductible attached to it. And so Medicaid makes a huge difference.
So you touched upon this a little bit, the different types of Medicaid we have. It's for people who have physical disabilities, people who have low income, women who are pregnant. But you also mentioned there is NC Caretaker Coverage. What is that?
So in North Carolina, if you're a caretaker of a child under the age of 18, then we potentially have coverage for you. I wasn't aware that that is not something that happens in all the states until I had a case where I had a family that had moved here. I think it was from Florida, don't hold me to that, but they had moved to North Carolina, and he had an injury at work, and he was having a lot of trouble with workers' comp, and he was out of work, and his wife was struggling to pay for all the bills on her income. And I just mentioned it to them, and she said, I had no idea that that was even a possibility. So they would just have to be living with the child. The child has to be under the age of 18, and they have to be related to the child to a certain degree. So it would be grandparents, parents, aunts, siblings, that type of relation.
So how long do you keep Medicaid?
I'm sorry, Max, say that again.
Oh, sorry. How long do you keep Medicaid?
So most of our, it's called a certification period. So most of our timeframes are a year. The deductibles that we spoke of a moment ago, those are 6 months. And we would reevaluate their eligibility at the end of that period. The great thing about the children's coverage is if the child is under 19 during that year timeframe, we don't react to any type of income changes. So if the parent were to change jobs and get a really great, raise, we're not going to look at that until the end of those 12 months.
Okay. So you mentioned this to me before about a marketplace, like a federally facilitated marketplace. Like, what does that mean?
So there are several ways to apply. First off, the marketplace is one of them. The marketplace came about as part of the Affordable Care Act. So a lot of times we receive applications because our residents go onto the marketplace looking for coverage. And when they submit that application, the feds are looking to see if if they perceive them to potentially be eligible for North Carolina Medicaid. So they send us like a referral. It triggers an application to us. So if they will allow us to go through that process with them, even if we determine them to be ineligible for Medicaid, it opens up cost sharing and advanced tax credits to the applicant that they wouldn't normally be able to have access to.
Great. So in this show, we've talked about how you can get housing assistance, how you can get food assistance, how you can get continuing education assistance, and how you can get health insurance. And I hope it's not coming off as confusing, because if you call 250-5500 and you request to speak to someone, you will speak with maybe one of you four, but certainly someone who will see what you need, see what services are available. And there are many more services than we're even talking about in today's episode. I wanted to get into questions. So another call for questions. We have a couple of them to get through. So one question came in from Facebook, and we just got another one. Can housing assistance cover gas bills as well, or cover oil costs? We went over this, but let's go over it again for people just tuning in.
Yes, those are part of the utilities that the COVID housing program can assist with. And just like we've spoken about a number of times, once you're in touch with that caseworker, that caseworker can help you to get the sort of bills that you need to show, what you owe. But that is a bill that we can help with.
And even outside of the COVID, there's the emergency assistance piece of that too.
So if someone was found to be ineligible for the COVID assistance, they can definitely check with our normal programs through Evelyn Charities that can do the gas bills as well.
Great. We had a question come in online about medical help. Granted, we talked about Medicaid to an extent, but are there any restrictions as to what kind of services you can get with this medical help through Medicaid?
So there is a list of services that are approved by Medicaid. It's basically all medically necessary services. Like I said, doctor, hospital. I don't think I mentioned ER or hospital stay. So it's full coverage. Yeah, definitely, yeah.
And to get in touch, you can either go to find out if you can apply for any of these. Again, call, or you can check out the link in the chat that I put in there about the ePass program. So we have a little bit of time left. We may not have to go for the whole hour, but I wanted to ask for some anecdotal stories from each of you. So if let's start with, Becca, you have your hand up.
Well, I just wanted to follow up on that last question. What I would say to our residents of Buncombe County is it follows up on what Nick said earlier. We have some of the best caseworkers in the state of North Carolina here. They care about our families and our residents. And if there's a situation that comes up, we literally work for you guys. So if something happens, if you're not sure, kind of like what Tiffany said before, you don't have to have a single piece of your information together to apply. Please go ahead and make that application or make that phone call and let us look at it, because there are so many programs. And if you don't fit here, then you might fit here. And if you don't fit in this program, then you might fit in another program. So we really do want them to contact us and let us see what we can do to help them.
I'm sure all four of you have so many stories about someone calling you for help with one thing and receiving assistance more so than they thought they would. But would anyone mind to share a story of a client that they've worked with, where they came to you and you were able to help them, and what you were able to help them with?
Sure, I don't mind to start. This is actually a story that one of my staff members shared with me. It was back in December, and this is just one story, and this is probably a story for many people. So back in December, it was a household of 4. It was a mom and dad and 2 children, and both of the children have really a rare medical conditions. So they actually had, the mother and father both were advised by the primary care physician of the children that they needed to quit their jobs because of COVID. So they were extremely stressed. They had never applied for assistance before in their life. They didn't know where to begin. So long story short, they come in and applied. We were able to help them. They had applied for unemployment, but they hadn't got approved yet, and they had no income, and they were going to lose their health insurance. And so we were able to take that food application for them. We were able to get them approved. And then they were very thankful and sent a letter in because they were able to get their benefits in time for Christmas to try to have a normal Christmas. But also it just eased their mind. But then also we were able to link them with Medicaid so that they could go ahead and make an application for Medicaid. So that alleviated that stressor for them as well. So a lot of times when clients come in and apply for one program, the workers are really good about trying to recognize if they would benefit for other programs, and we can get that referral or link them up with that worker. So that was a really great story. And I'm sure there are tons of those same situations from this past year.
We have a really good question from attendant here. Does the COVID housing assistance help with phone or Wi-Fi service, internet?
With internet service, it does. And if you and we're still kind of working out the details on exactly what we need to get in order to approve those sorts of applications, but the internet portion of it is definitely written into what we can approve.
Okay, so we're still working on the finer details of it, but there are.
Yes, I'm sorry. We are. It's kind of like an ongoing, like everyday thing right now. So, but I just got to continue to stress that, you know, it doesn't hurt to go ahead and put that application and give the call, put your name on the list. We'll talk to you about it, and if you're eligible, we'll approve you. So
Great. So I don't see any more questions coming in from anyone. Rather than kind of I think this was a lot of great topics of conversation. I'll give everyone a chance to speak for just a little bit on a final thought about the assistance program you were talking about, or anything you want the public to know about, or just well wishes. Let's start with you, Nicholas. Let's go in the order.
Oh, well, I guess that, you know, I was going to just share an anecdote, which was what we were just doing, and just kind of off what Tiffany was saying, you know, this last year has affected so many people in so many ways, and that this program is really been helpful to a lot of folks. And I had a gentleman last year, and you know, I think we all remember that, you know, all of a sudden the restaurants had to close and the gyms had to close, and you know, the breweries had to close, and these are so many jobs here in Asheville, you know, that you would expect. But then there's other things that happen that I didn't really think of. And here a gentleman came and applied, and he ran a landscaping crew, and I'm not sure if it was because of the governor's orders, or if it was just because of him being safe. But what he would do is he'd have 3 or 4 guys in his truck, and he'd go around to different places, and these 3 or 4 guys were able to do a whole lot of work. And you know, all of a sudden, you know, it was dangerous to have 3 or 4 guys in your truck. So, you know, I'm not sure if it was by law that he had to, but he didn't feel comfortable at all. So he could only have himself in his truck, and he was able to get so much less work done. And so, you know, he got, you know, a lot less done, and he was making so much less money. And so he got behind, and, you know, he didn't, you know, really know what to do. He got behind on his bills. He got behind on his electric bill and his rent. And he gave us a call, and I think that we were able to catch him up with 4 months of rent. And so we got him caught back up. And it's just, you know, so many people were affected in so many different ways that you might not think. So Um,
It's
That's
not
just
future
one
bills,
side
it's
on it.
past bills too.
That's right. That's right. So, yeah, but you know, it's really helpful for a lot of folks who got behind. So I'm happy to be helping out with it.
Great. Anything, Tracy? Anecdotes or well wishes?
Well, I think with the pandemic, a lot of people have been displaced from work. And if they're looking for career change and they're receiving food and nutrition services, definitely check into the skills training and employment program. We help people coming from lots of different situations. We did have one person that was out of the workforce for 6 years, and our career center was able to work with her, and she ended up getting hired on with the county. So that was a success story for us. But since so many people are really seeking employment, the skills training and employment program can really be helpful.
Awesome. Thanks, Tracy. How about you, Becca? What are some last thoughts from you?
I think I might have said mine previously, but I just really would like to encourage anyone who has any type of medical need to call and just touch base with us, if not just putting in that application. To remember that if you suddenly get a call from us and you didn't apply with us, but you did go on the marketplace, you went to healthcare.gov and you submitted an application. If we call you, it really is in your best interest to go ahead and go through with that application, because a lot of times it can be confusing to people and not sure why we're calling because they didn't specifically apply with us, but it really can help them financially. And to remember that there are some really there's some situations where you wouldn't think Medicaid could help. The workers' comp issue, the gentleman that I was talking about earlier, the workers' comp wouldn't pay for his surgery. So we were able to pay for that surgery. And then when he got all of the workers' comp process worked out, then workers' comp paid Medicaid back. But he was well on his way to getting better by that time. So there are just a lot of situations that are specific to Medicaid, and we would love to talk about those with anyone who has a need.
That's awesome. So I want to thank all of the panelists for coming here today. And if you watch this even for just a few minutes on Facebook, or if you participated in the Zoom call, these are life-saving services, and this is services that you may not think you're eligible for, but you actually are eligible for. These may be services you might not even know exist, and they exist. And we only went over the basic ones today. There are so many more resources that our Health and Human Services, Economic Services staff can connect you to. So I implore everyone, call 828-250-5500. And just ask if you're eligible. Like, what's the harm in making a call? You could get a lot out of it. Clearly, a lot of people do already. So thank you to all of our panelists, and thank you for watching. And I hope you all have a great evening.
Thank you.
Thanks.